Okay, so the item, third item on the agenda is the report of the 9/11 Telecommunicator Pension Benefits Working Group. Mr. Burkitt, could you please give us an overview of the report? And that should be available, members. It's quite hefty, but we do have. Okay, Mr. Burkitt.
Thank you, Madam Chair. And I do have a just short presentation on the report here. I'm going to attempt to share with you all.
Okay.
All right, can everybody see that okay?
Yes.
And members, this presentation just goes section by section through the report itself. This is the report of the 911 Telecommunicator Pension Benefits Working Group. The working group was established to study pension benefits of 911 telecommunicators. In the enacting statute, the working group was required to provide a report to the LCPR and must recommend whether changes to pension plan coverage for 911 telecommunicators are appropriate. If the working group finds that such changes are appropriate, the working group must recommend changes to the pension plan coverage for 911 telecommunicators. Recommended changes may include, but are not limited to, moving 911 telecommunicators to the correctional plans. So as I noted, the enacting legislation required the working group to study those issues and then report its recommendations to the LCPR. It held 6 meetings between July 2021 and February 2022. It submitted its report on February 6th of 2022, completed its work actually at the end of January. The working group had 12 members on it. Pankonie served as chair. I believe she's here to testify today. And Matt Hilgart served as the vice chair from AMC. Also, the working group was advised by Wade Laszlo on issues related to the local government correctional plan. And I believe he's here to testify as well. And then LCPR staff provided administrative support, including assisting with drafting the report. Section 3 of the report goes through the background information on 911 telecommunicators. There are 1,500 911 telecommunicators in Minnesota. For the purposes of the report, the working group just looked at public employees who are covered by a state public pension plan. Those public employees are mostly employed by counties and municipalities, though there's about 81 employed by the Department of Public Safety. Looking at pension benefits for 911 telecommunicators currently, of those 1,500 in Minnesota, 1,300 of them are covered by the Para-General Employees Retirement Plan. According to a survey that the working group conducted, they identified another 93 who are covered by the Para-Local Government Correctional Retirement Plan. Those dispatchers are in dual role jailer dispatchers. That's why they have the Para-Local Government Correctional Retirement Plan coverage. As I noted before, there's 81 positions in the Department of Public Safety who are covered by the MSRS General Employees Retirement Plan. These dispatchers dispatch for the State Patrol and for conservation officers and for MnDOT. And then there's a small group, 25, who are covered by the Para-Police and Fire Department Fire Retirement Plan. And this group is emergency medical dispatchers for Hennepin Health Services, and they are also in dual roles as EMTs or paramedics. This table just compares the 4 different retirement plans that 911 telecommunicators currently are in. I think the main takeaways here are that the para-correctional and para-police and fire plan, of course, provide slightly better formulas. In the case of the para-police and fire plan, a 3% compared to 1.7% formula is quite a bit better, but the police and fire plan is not coordinated with Social Security, so its members don't receive Social Security benefits and don't contribute to Social Security. And then the other main aspect to note is the difference in the normal retirement age of 55 for the correctional and police and fire plan compared to 66 for the general plans. Section 4 of the report covers the The working group study. Subsection A discusses the main issue that the working group was asked to study, which is whether 911 telecommunicator pension benefits should be changed. The members of the working group did not agree that they should be changed, and they really offered different viewpoints that are covered in the report. And the different viewpoints coalesced around whether the members were 911 telecommunicators or members of a city or county organization like AMC or MICA, or the pension fund directors or correctional plan participants. Subsection B covers the cost of changing 911 telecommunicator pension benefits, which is something the working group discussed. Really, the working group was able to look at one scenario, which was transferring members from the para general plan to the para correctional plan. Doug Anderson, who's the executive director of para, provided an estimate of transferring the past service credit, and they estimated that it would cost about $79 million. He was unable to estimate the ongoing cost of the benefit to the correctional plan that would occur because it lacked a thorough actuarial study, which would be needed to make that estimate. Subsection C of the section also covers survey results. The working group conducted a number of surveys, some of which were very thorough. One survey of statewide 911 telecommunicators, which you can find in the appendix to the report at B9, covered 921 respondents, which is the majority of the 911 telecommunicators in the state. Again, a thorough survey. 94% of its respondents indicated a preference for the paracorrectional plan. Respondents were asked, do you feel that your ability to perform your job effectively and efficiently has declined as you age? 49% said yes, and 51% said no, although of respondents who are age 60 or older, 57% said yes and 39% no. Employers, organizations also conducted surveys of counties and cities. One survey of counties found that the percentage of 911 telecommunicators who separated employment between 2016 and 2020 was higher than the percentage of the total of all county employees who separated during the same period. High turnover rates during the probation or training phases and in the early years of employment, as well as mental or emotional stress and the difficulty of the job, were some of the reasons cited in the survey for the high turnover rates. Survey also found that 911 telecommunicators are less likely to file for workers' comp than are correctional officers. And finally, that counties split on whether hiring 911 telecommunicators is more challenging relative to other classes of employees. The working group also asked the National Association of State Retirement Administrators, or NASRA, to survey its members on their 911 telecommunicator pension policy. And of the 18 states that responded, one indicated that they provide benefits from a public safety plan. The rest provided benefits from their general plan. Finally, the working group discussed whether 911 telecommunicators should be covered by a correctional plan, and ultimately determined not to recommend that 911 telecommunicators be covered by a correctional plan, largely due to opposition from correctional plan members. And the final section of the report contains the recommendations of the working group. The working group discussed the recommendations at length and really got into the specific wording of it. And so I think I'll have to read that to you verbatim here. So the working group recommends that the public employees of 911 telecommunicators evaluate the wages, compensation schedules, other employee benefits, work scheduling, the work environment of 911 telecommunicators for adequacy and parity. The working group recognizes that the nature of 911 telecommunicators work is stressful and regularly exposes 911 telecommunicators to traumatic situations. Working group recommends that the legislature provide for improved availability of mental health care for 911 telecommunicators. Working group did not agree on whether pension benefits for 911 telecommunicators should be changed. However, if the legislature were to establish a plan providing for enhanced pension benefits for 911 telecommunicators, the working group recommends the following. First, that eligibility criteria for the plan should clearly define the employees who are eligible and those who are not, providing a clear definition of 911 telecommunicators. Participation in the plan by eligible employees should be mandatory. Second, third-party Certification or licensure as a 911 telecommunicator should not be the sole criteria for determining eligibility to receive enhanced pension benefits. Third, the state should provide sufficient funds to ensure the funding ratio and projected funded status of any existing plan is not negatively impacted by any change in pension benefits for 911 telecommunicators. The state should also provide funds to cover the expenses related to establishing a new plan or tier of benefits, including actuarial fees for evaluating benefit proposals. And finally, 911 telecommunicators who are state employees should be covered by the same plan as 911 telecommunicators who are local government employees, and the plan should be administered by PARA. And then finally, appended to the report is an appendix, and that appendix covers all of the data, surveys, cost estimates, and other things that the working group considered during its several meetings. And I want to especially draw your attention to the position or policy statements from these groups that are listed here, since these are especially directed to members of the commission. But we also received testimonials from 911 telecommunicators as well as correctional officers and some other miscellaneous items, and those are listed in the appendix. And the appendix is fairly lengthy, 187 pages, but does contain some really good information. I'm sure that is the summary of the report. I believe Ms. Pankonie is here as well to testify.
Thank you, Mr. Burkitt. And there is a letter from the Minnesota Correctional Officer Retirement Association, MNCORA, who is strongly opposed to admitting 911 telecommunicators into the PARA correctional plan, just in your packet. And with that, we will turn to Ms. Pankonie. Welcome to the committee.
Thank you, Madam Chair. Thank you for allowing me to speak to the commission this evening. Our report was delivered, and Chad did a very good job of giving a summary of it at a high level. It contains extensive information, as he stated, almost 200 pages in an appendix. We did quite a bit of work, and it gives recommendations that were agreed upon. I am not going to cover the details of the report tonight, definitely can answer questions, but rather I just want to give an overview of the working group direction. Again, it was my honor to chair this 911 telecommunicator pension benefits working group, which was established to study the pension benefits of 911 telecommunicators. The tasks that the legislature gave to us were: number one, recommend whether changes to the pension plan coverage to 911 telecommunicators are appropriate. And then number two, if it is appropriate, recommend changes to the pension plan coverage. Senators and representatives of the commission, I am disappointed to not be able to bring back to the commission a clear recommendation on whether changes are appropriate, and therefore any consensus for changes to the 911 telecommunicator pension plan. The working group's initial focus was task number two, as it suggested existing correctional plans as a possible plan coverage. This was suggested for several reasons. The correctional plans were established, the plans had benefits 911 telecommunicators desired, and one correctional plan currently covers telecommunicators with job requirements in both communications and corrections. After several meetings, it became clear that consensus to move 911 telecommunicators into the correctional plans was not going to occur. Therefore, I redirected the group to focus on the first item of whether changes to the pension plan coverage were appropriate. The working group views were aligned in the areas of their representation, as Chad stated in the summary. There were 5 members of the working group who represented the working 911 telecommunicators. All these members have decades of personal experience in the 911 emergency communications field. These members are clear and firm in their conviction that 911 telecommunicators should have enhanced benefits of increased retirement formula and lower retirement age without a reduction in compensation. Representatives of the correctional employees, both the employers and the pension fund members, made it clear that they opposed further membership in their pension funds, thus making consensus on this topic out of reach. The employer groups representing the majority of the 911 telecommunicators, AMC, LMC, MICA, and DPS, showed genuine interest in the working group. Collaborative efforts were made to collect and discuss data and information. Though the work was done, this did not compel a definitive position of support to enhance benefits for telecommunicators from these employer groups. Senators, representatives, time and time again, as telecommunicators seek to get equitable representation in the field of public safety, a cloud or storm of other issues moves in to overshadow the focus. I ask that the commission embrace accurate views of 911 telecommunicators, that which is coming from people who are experts in this field. The opinion of those who are coming from the outside are not as credible. Please consider the public safety issues that continue to arise and which all of you are asked to address and resolve. Just two of them earlier in this meeting tonight. Do not some of these issues that come to you point to the 911 telecommunicator as a solution? In 2020, they were required to deliver CPR over the phone to save lives. In 2021, they were further required to ensure mental health services referrals in those in need. And I have no doubt as more issues arise in the public safety field, 911 telecommunicators are going to be asked to help resolve those issues and find a solution. And they are willing to rise to that task. The 911 telecommunicators across the state are vital. They are public safety responders. They deserve equity to other responders for the work they do. It is time to do the right thing and bring pension benefit compensation on par with our state law enforcement, firefighters, EMS telecommunicators, and correctional officers. I hope the commission considers recommending changes to the 911 telecommunicators pension in the 2020 legislative session. Again, it was an honor to chair this working group. It truly was. I thank the commission for making it possible. I also want to thank the LCPR staff who are incredible. Susan, Chad, Lisa, all their hard work. Could not have done this without them. I enjoyed working with all of them. It was pure pleasure. And I thank you for your time, Madam Chair. Madam Chair, I think you're on mute.
Yeah, thank you. I have to have one of those. I was just thanking you for being chair of this committee. And I know there was a lot of meetings and it was there was a lot of discussion. So I really appreciate you being the chair of that. Any questions for Ms. Pankonie? Okay, well, welcome, Mr. Laszlo. Am I saying that right?
Yeah, yes, you are. Thank you,
Okay.
Madam Chair and commissioners. And also to Susan, I do want to thank you for letting me be the advisor on this committee. My name is Wade Laszlo. I'm a retired detention deputy from the Hennepin County Sheriff's Office. I worked from 1990 to 2016. I was a union steward for a large percentage of that time. I was chief steward for Teamsters Local 320 until 2011, when we decertified and went over to the Minnesota Public Employees Association, where I was a steward until I retired. I was also elected as a national delegate to the Teamsters International Convention in 2011. And in November, I was appointed the president of the Minnesota Correctional Officer Retirement Association. So as has been brought out, the corrections officers are opposed to this. I'm also one of the original people from back in the 90s that worked on getting the correctional plan. And we had very stiff opposition from police and fire, from the MPPOA. We were called glorified security guards that did not deserve the same pension as police and fire. We worked very hard to get our pension. We did it through disability. And we had to prove high levels of injury, exposures to disease. Originally, it required 95% inmate contact. The present definition by statute and found on the PARA website says, the correctional plan was established in 1999 for correctional officers serving in county and regional adult and juvenile correction facilities due to the physical nature of their jobs. The members of this plan are responsible for the security, custody, and control of the facilities and their inmates. The plan has about 1,000 retirees and boasts 3,700 working local correctional officers. And if you think about the plan, counting, that's roughly 3,700 people or 4,700 people. You can double that when you consider beneficiaries. Over the years, I've seen corrections officers punched, beat, exposed diseases. COVID ran rampant through the jails. And that was not the case with the 911 dispatchers. I'm jumping around a bit due to time constraints, but if you look in their appendixes, there's worker comp numbers that are listed in there. After COVID hit, fully 28% of all CO injuries were put down as disease. It was 0 for dispatchers. Also, too, in the years from 2012 to 2020, injury claims here, there was 22 by dispatchers, 937 by corrections officers, and 37% of those are categorized under violence, which also doesn't affect dispatchers. We have no problems with dispatchers having their own pension, but our pension was based on physical contact. I like to use this analogy. My grandfather worked for the Milwaukee Road Railroad. He had a real sweet railroad pension. I would love to have the railroad pension, but I didn't work for the railroad. The dispatchers, while they are part of public safety, do not have the same inherent dangers that we have that are recognized by statute for police, fire, and corrections. And that's the physical danger. That's the physical danger that's involved. The Minnesota Correctional Officers Retirement Association did submit a letter that's part of your packet. I would encourage all of you to read it. There is one change in there at the time when it was written. Item number 4, whether the one item in there, they didn't answer the question about should 911 telecommunicators be covered by a correctional plan. In the original PowerPoint, that wasn't listed. And the committee did say the working group decided not to recommend that 911 telecommunicators be placed in the correctional plans. This decision was in response to position statements submitted by groups urging the 911 telecommunicators not be placed in the correctional plan, including the Minnesota Department of Corrections, the Minnesota Department of Human Services, and the Minnesota Correctional Officer Retirement Association. There's several letters in there from retirees, current people. There's also a petition that was signed by 88 detention deputies working at Hennepin County opposing their admission. Ours is the best funded and best run pension plan, and we'd like to keep it that way. And by adding people in, I know there was an estimate of $79 million to put them in the plan. No extra was done. Nobody knows how much damage or how much that could do to our pension. And if anything, especially during this high inflation, if, from the correctional point of view, we should be looking at things like bringing us up to parity with MSRS. Our retirement numbers are 1.9%. Theirs is 2.2. We've kept ours low since the inception of the plan. And anyways, just, thank you again for your time, and just letting you know we are very vehemently opposed to this.
Thank you, Mr. Laszlo. I appreciate you working on this also. Are there any questions for the 2 testifiers? Mr. Mossman and Mr. Hilgart are available to answer any questions. Can someone please tell me, either Mr. Anderson or Miss Leonard, how much this would cost if something like this happened? Is this the transfer of past service estimated at $79 million for para? Is that correct? Mr. Anderson?
Yeah, Madam Chair, that was an estimate to try to get a sense of if this group was moved from the para general plan to the para correctional plan. It's valuing really 3 major changes to the benefit. One is the multiplier would increase from 1.7% to 1.9%. The second, and probably the most valuable thing, is that there's no reduction for earlier retirement. So the unreduced retirement age changes from age 66 to age 55. And the third component is that the post-retirement increases are better under the para correctional plan than under the para general plan. All 3 very valuable. So we looked at the impact of, if you just look at the past service for all members, and if that were to move over from the general plan to the correctional plan, what is the single present value of the cost to move that service over? So that was just the estimate for that component. It's a little different than what you usually see from an actuarial evaluation where you get a past service component and a future service component. But it just serves to give an idea of what it would take if that transfer were to occur.
Thank you. Mr. Laszlo?
Yes, if I may add one thing too. When we started into correctional plan, we had to leave all of our time in the previous plans. I left 9 years in the general plan when I transferred over. For dispatchers to be allowed to transfer into our plan would be a benefit that was never given to corrections officers. And we would also be asking parity on something like that because most of us left, especially us old timers, left time in that plan.
Thank you, Mr. Laszlo. You bet. I know Senator Carla Bingham this was her bill last year, and in brief conversations with her, we talked about, which is on page 9, the working group recognizes that telecommunicators' work is stressful and exposes them to traumatic situations. Perhaps we could look at improved availability of mental health care for 911 telecommunicators. We did talk about that, Senator Bingham and I, and if there's any other kind of relief that possibly we could direct in that way. That is certainly open to discussions and would like to continue on with that. I don't think Senator Bingham is on tonight, but Ms. Pankonie, you had your hand up?
Yes, if I can find all the buttons here.
Yeah.
Thank you, Madam Chair. I just wanted to, as I found myself many times in the working group, try to redirect the discussion. This isn't about corrections. The corrections has their fund. One thing we were asked to is, should they be moved? We understand that there is resistance to have anything moved into their correctional pension funds. They're very protective of them. They have their reasons. But that isn't the point or the task ultimately at hand. And that was, do 911 telecommunicators deserve enhanced pension benefits? And that's what I guess I asked the commission to be refocused on, because I believe they do, and many believe they do. And unfortunately, that is what we're offering back, or it's back on the plate of this commission to ultimately make that decision, because this working group could not come. We were in disparate positions to begin with. So I think, with the membership of the working group that was pulled together, I don't think consensus was going to happen. But in the report, you will find lots of information that I think individually you're going to have to decide for yourself. Is there evidence to suggest, or from the knowledge that and others that have working knowledge of a 911 or emergency communication center and the work that they do they deserve equality amongst public safety responders? And I believe they do, and many believe they do, as Senator Bingham, who brought this forward. And it's time to recognize that.
Mm-hmm. Oh, thank you, Ms. Pankonie. I appreciate that. And that was something I'm glad Senator Bingham brought this forward. But we do take recommendations from these work groups very serious. Again, in the recommendations from the working group on page 9, it says that the working group recommends public employers for 911 telecommunicators evaluate the wages, compensation schedules, and other employee benefits, work scheduling, and work environment of the 911 telecommunicators for adequacy and parity. And I think that's a direction, perhaps with some mental health delivery access, better access to mental health care would be appropriate, because I don't know of any other time that we've gone against a working group, but I could be wrong. And I'm open this up for discussion, members. I think Mr. Burkitt's summary, Mr. Burkitt, this is very good. And I really appreciate you putting this together. This is very, very good. Yes, Representative Frederick.
Madam Chair, I just want to put out there real quick, in listening to this and reviewing the materials, I can't help but think about the men and women that work in correctional settings, those that work in St. Peter at the security hospital. And there are some people at those facilities that are covered with the corrections pension. And there's also a lot of employees there that are not, but they're exposed every day to the same violent individuals that people who are covered under the, excuse me, under the corrections pension. And I don't want to ever tell one group that they are more valued over another, but I think this discussion kind of lends its way to a broader discussion on some of these other workplaces that, you know, there's lots of different workers who are exposed in violent fields that could use enhanced benefits, as I think the term was coined. And so if we do it in one, I would encourage us to look at more because I think there's value there. I think that's also part of the thing that I don't want it to be a slippery slope though either, because I'm sure some of the fund managers out there are like, whoa, we got to make sure these things stay in the green or, you know, as close to that as possible. But I think that's just something that we have to be cognizant of as we work through this.
Thank you, Mr. Representative Frederick. It is a slippery slope, and it's very expensive slippery slope. Senator Friends.
Well, thank you very much, Madam Chair. Thanks, Ms. Pankonie. Thanks, Mr. Laszlo. First of all, Representative Frederick's a little too modest. He was a member of corrections and worked as a constituent of mine in St. Peter at the security hospital as a protector of the system and also of mentally ill and dangerous patients. So sorry, Representative Frederick, but I'm outing you there. To the question at hand, Senator Rosen, I think the points being made are good ones, which is we have to be very careful here if we're going to draw lines between groups of Minnesotans. And we have probation officers in our district who have similar characteristics. And I think we have to move very carefully here. There is no question that 911 telecommunicators are worthy of respect and enhanced benefits. The question is not are they, but who else and what does it cost? Also, the question of retirement age at 55, I wonder if there's room for discussion about that age and whether that has to be applied equally or whether a different age might be appropriate. I don't know the answer, Madam Chair. Just I think those are still some questions to be put forth to the Pension Commission and to the House and Senate as a whole. Thank you very much.
Yes, thank you, Senator France. Very well said. Absolutely. I would like to personally thank everybody that served on the working group. Thank you for your time and energy and knowledge and your commitment in this arena, your service, especially the telecommunicators too. That's a huge job, very stressful job. I understand that. But as I said, I think we take these working groups very serious. I'm glad it was brought to our attention, but there are some recommendations that we should probably look at seriously going forward and continue the conversation if need be. There's no other further questions. I think that 10 minutes after 6, that's not bad compared to the 2.5 hours I usually put you through on a Tuesday night. Members, I would continue to hold Tuesday night available. I'm not sure if we're going to be ready for next Tuesday night. We do have some bills coming. They're just not quite ready yet. So buckle up. Senator Pappas, you had your hand up and now it's back down.
Madam Chair, that was my question is what's the plan in the next few Tuesdays?
Right. My hope, seriously, is to get another pension hearing together for next week. Just not quite ready yet to say exactly what it's going to be. February forecast is coming out, you know, on the 28th. So things are going to get very rapid very quickly.
Madam Chair, don't we usually hear from the firefighters working group? I don't know if they have any changes or do any of the fund plans have like technical bills that we could just get out of the way?
Right. Yep. Thank you, Senator Pappas. Ms. Lancheski, what do we have on the docket?
Yeah, Senator Rosen and Senator Pappas, the working group bill just went to the revisor's office, I think today, and they are pretty backed up. So I don't know when that will be jacketed and sent over to Senator Rosen. And then with regard to any sort of administrative bills, we don't actually have any from the funds this session. It's possible something could come along, but I don't believe there is anything in the works right now that it is an administrative bill.
Senator Pappas? But please hold the next Tuesday available, and I will
That's
let you
fine.
know as soon as possible. Any further questions, comments? Again, thank you so much, everyone, for your time tonight. The Legislative Pension Commission is adjourned. Thank you.